Hello! This video will be dedicated to the community empowerment approach to HIV among sex workers, which we introduced in the previous presentation. In the course of this presentation, we will try to focus on three things. First of all, we will try to unpack what the community empowerment approach to HIV prevention among sex workers means. Also, we will intend to identify the key components of community empowerment-based approach, while simultaneously showing you some of the good practices in sex worker-led HIV prevention interventions globally and in the European region. As we mentioned in the previous video, sex workers' involvement in HIV response has gained in the recent years increasing recognition from different international bodies addressing the impact of HIV epidemic. What has been stressed is the fact that sex workers groups and organizations should be made essential partners and leaders in designing, planning, implementing, and evaluating health services for their community members. To go even further, it is claimed that sex worker leadership is critical to ensuring that social and structural factors affecting sex workers' health, human rights and well-being are understood and addressed in generating and sustaining effective response to HIV. This lies at the basis of community empowerment approach. According to the SWEET tool we mentioned before, community empowerment-based response to HIV is a process whereby sex workers take individual and collective ownership of programs in order to achieve the most effective HIV responses and to take concrete action to address social and structural barriers to their broader health and human rights. What is crucial? Community empowerment is a holistic approach based on human rights framework and combining variety of behavioral, community and structural interventions. The SWEET tool identifies 6 key elements of the community-based approach. Community empowerment, addressing violence against sex workers, community-led services, condom and lubricant programming, clinical and support services, as well as program management and organizational capacity building. For the next few minutes, we will try to tell you more about this. The first and the most fundamental element of community empowerment approach to HIV is a community empowerment itself. Namely, the strategy linking community mobilization and self-organization with interventions addressing social and structural factors contributing to sex workers' vulnerability to HIV. In other words, community empowerment means promotion of cohesion among sex workers, development and strengthening of sex worker collectives and organizations, assuring meaningful participation of sex workers in the design, implementation, monitoring, and evaluation of HIV programming, and sustaining sex workers' movement. We know a lot of different strategies used by sex workers to mobilize sex worker community and strengthen sex workers' movement in their local and national context. For example, Star in Macedonia organizes various workshops and trainings during which community members learn about their rights, history of sex workers' movement, and issues around sex workers' occupational health and safety. Since 1999 already, sex workers in the San Francisco Bay Area organize a sex worker film and arts festival that provides a forum for sex worker film and video makers and gives community members from around the world a chance to share their stories, experiences, and demands for visual tools, such as films, videos, and performances. The Crosstalk project in the UK is a sex worker-led workers' cooperative which provides language classes for migrant sex workers to empower them in interactions with other community members, clients, third parties, and law enforcement agencies. Ukrainian sex worker collective Legal Life, in turn, publishes newsletter Lilith, developed by the members of the collective and distributed among sex workers working in Ukraine. It constitutes an important platform of communication and a tool to provide sex workers with opportunities to share their experience, gain knowledge about their rights, and strengthening their collective. What is also important, community empowerment includes working towards the decriminalization of sex work and the elimination of the unjust application of the non-criminal laws and regulations against sex workers. It includes, therefore, advocating for the decriminalization of sex work and other legal reforms, fighting against discrimination, stigma, and other human rights violations against sex workers, and struggling for the recognition of sex workers' human and labor rights. We will show you some of the examples of sex workers' protests and manifestations against oppressive policies and policy developments introduced across Europe. For example, you can see members of STRAS, French sex workers collective, demonstrating against governmental attempts to criminalize sex workers' clients, or sex workers in Barcelona, Spain, opposing city council ordinance restricting sex workers' freedom of movement and ability to work by banning outdoor sex work, and eventually sex workers in Amsterdam protesting against closure of windows in red light district in 2015. These are just some of the examples of sex workers' attempts to address structural and legal factors contributing to sex workers' vulnerability to HIV. Community empowerment approach also involves direct engagement in interventions, shaping policy and creating and enabling environments for sex workers, as well as addressing barriers to sex workers' health and well-being. Some of the examples might be the parliamentary meeting on criminalization of sex workers' clients, organized by the English Collective of Prostitutes and the People's Parliament in the House of Commons in London, UK, in March 2014. During this meeting, sex workers from across Europe have been speaking out against governmental proposal to introduce the Swedish model, criminalizing the purchase of sex. Also, in February 2014, ICRC led a vocal campaign against the European Parliament report on prostitution and sexual exploitation, so-called Hannibal report, which equated all forms of sex work with violence and sought to recommend the Swedish model of client criminalization Europe-wide. In the course of this campaign, ICRC issued a letter supported by 560 organizations, sent individually to target members of the European Parliament and urging them to vote for an alternative resolution, drafted in consultation with ICRC. A critic of this resolution was also signed by 94 researchers and public health academics. This earned ICRC increased visibility among European NGOs and members of the European Parliament. And the last example of sex workers' direct involvement in processes shaping policy and creating enabling environments for sex workers will be the global campaign led by the Global Network of Sex Work Project in summer 2015. This campaign aimed at supporting Amnesty International in adopting a policy draft on the criminalization of sex work, which exposed Amnesty to great critique of abolitionist and anti-sex work organizations, as well as several Hollywood celebrities. A petition developed by the NSWP was signed by over 10,000 people and led to success because eventually Amnesty International adopted the draft recommending the criminalization of sex work. The second key component of community empowerment-based approach to HIV involves addressing violence faced by sex workers. This means developing interventions, preventing and responding to violence against sex workers across the world. This might include advocacy for the law reform and change in law enforcement practices, by exposing tremendous levels of violence against sex workers and advocating an end to abuse and harassment, as well as human rights violations faced by different subpopulations of sex worker community throughout the world. Several organizations gather data on violence and human rights violations experienced by sex workers and report this data to governmental institutions and human rights instruments. Some other organizations address issues around sex workers' vulnerability to violence through sensitization workshops for the police and law enforcement agencies. Such workshops aim at increasing knowledge of those to violence of the police, to violence faced by sex workers and prevent them from harassing the most marginalized communities. Let's watch a short video which features this kind of interventions and explains their importance for the effectiveness of HIV response among sex workers.
There are a lot of countries where HIV infections are growing, not decreasing, even though we know how to prevent HIV and how to treat it. People who are getting HIV are also grappling with other issues. One of those issues is the fact in many countries that they are criminalized. Many sex workers and drug users think, because I'm doing something illegal, I don't actually have any human rights anymore. Sometimes the police use possession of a condom or a needle as evidence of wrongdoing and charge you with the crime. There's a lot of evidence about the ways that police act as a barrier to HIV services for vulnerable groups, but there is also increasing evidence of the ways in which partnerships between community groups and police are serving to improve access to HIV services. In Kyrgyzstan, more than 800 police have been trained in a course in the police academy that features people who use drugs and sex workers as speakers to explain to police that instead of seeing just a criminal, you should think about them as people. If people are vulnerable to HIV, you should be treating them as vulnerable people and referring them to services. In Kenya, sex workers are actually participating on a regular basis in trainings for the police. The result has been a sharp decrease in violence against sex workers by the police, and for police, an increase in their feeling of safety and familiarity in some of the neighborhoods where they themselves felt unwelcome and at risk. All people in society have human rights, and that one of those rights is protection from discrimination or violence. We can't get to zero new infections or end AIDS if we don't address the role of law enforcement in either perpetuating risk or reducing it. We can't arrest our way out of the HIV epidemic. What we can do is support community police collaborations that actually change the way that law enforcement works.
What has also been recognized as critical are interventions aiming at promotion of safety and security among sex workers and providing sex workers facing violence with legal, psychological, and other services that they might need. Some of the examples might be online non-judgmental psychological counseling services, run for example by Silver Rose in Russia, or emergency telephone lines operated by numerous collectives across Europe, through which sex workers can report cases of violence and receive support. Community-based approach to HIV among sex workers also involves provision of community-led HIV prevention services. On the one hand, this includes community-led outreach, which is critical as it creates strong links between organizations and sex worker community. It's recognized as the best strategy to reach the most marginalized, invisible, and hard-to-reach sex worker communities, and an effective way to promote HIV services and prevention education. On the other hand, HIV prevention interventions may involve the development of safe spaces for sex workers, for example in the form of drop-in centers. Drop-in centers are the places where sex workers can socialize and relax. They may serve as a platform of community mobilization and asylum for those fleeing violence and facing homelessness. If you want to learn more about drop-in centers created for and by sex workers across Europe, we encourage you to take a look at the Open Society Foundation's publication, Centers for Change. Drop-in centers facilitate sex worker-led human rights advocacy, which is available in the training materials. Community-led outreach and creation of safe spaces for sex workers is also important as it facilitates condom and lubricant programming, another element of community-based empowerment approach. Condom and lubricant programming is about providing sex workers with means to and knowledge on how to protect themselves against HIV and STIs. It involves providing sex workers with evidence-based HIV prevention education, distributing high-quality male and female condoms and water-based lubricants, providing sex workers with skills to correctly and consistently use condoms, and building capacity of sex workers to negotiate condom use with clients. Another key element of community empowerment approach to HIV response among sex workers consists in provision of clinical and support services for sex worker community. Most importantly, however, it involves delivery of services tailored to sex workers' needs and expectations. This might include HIV counseling and testing, STI screenings, drug and alcohol use counseling, harm reduction programming, and information on gender reassignment surgery or hormonal therapy for sex workers that might need it. Apart from providing community members with essential HIV services, this component of community-based approach to HIV among sex workers also includes overcoming barriers to sex workers' access to HIV-related services through, for example, linking sex workers with trusted and sensitized service providers, training and sensitizing medical personnel to sex workers' rights and health needs, advocating for acceptable, affordable, accessible, confidential, and respectful services for sex workers, and monitoring respectfulness and quality of services. We invite you to watch a short video featuring a project developed by a Macedonian community-led organization, Star, and aiming at improving access of male, gay, and trans sex workers into secondary healthcare system. important, in the course of this project, STAR has led sensitizing trainings for healthcare professionals providing HIV-related services and created trusted physicians register with a list of medical doctors sensitized to sex workers' needs, which is available on the organization's website. And the last element of community empowerment approach to HIV involves building organizational capacity of sex worker collectives. Organizational capacity building is a comprehensive approach to strengthening an organization so that it can implement its own vision and strategy. Among others, it consists of building strong organizational structure and management, enhancing stability of community-led HIV programming by applying democratic principles in decision-making processes, enhancing sustainability and continuity of community-led programming in changing and unfavorable funding environment, establishing critical alliances and partnerships, as well as developing and implementing procedures enabling organizations to effectively respond to different crises and emergency situations. We will end by encouraging you to learn more about best practices in sex worker-led HIV programming. Several of them have been identified and described in more detail in one of the NSWP publications, Good Practice in Sex Worker-Led HIV Programming Global Report, which you can find on our online platform along with other interesting materials. Please feel free to share your thoughts and ideas on community empowerment approach to HIV among sex workers on our discussion forums created especially for you. Thank you.